New data shows Hoosiers are not going to the emergency room as often during this pandemic, and that's causing concern for some physicians. Take a look. In January, Eskenazi saw on average 300 ER visits every day. That number dropped to 170 in April. CBS 4's Aaron Cantrell explains why these statistics are so alarming to physicians.
Folks are not coming in for relatively minor things, understandably. But, unfortunately, I think we are also seeing fewer patients coming in scenarios where they really do need to be coming.
Franciscan Health VP of Medical Affairs Christopher Doring is very worried for some Hoosiers because he's seen almost a 50% drop in the number of patients coming to the ER.
That's the case around the city and the state, but also pretty consistent around the country, actually.
Eskenazi, IU Health, and Riverview Health Emergency Room and Urgent Care in Fishers are concerned too.
I don't think the message was meant to be if you're having chest pain or, appendicitis type pain or shortness of breath, whether it's COVID or not COVID symptoms, that you need to stay home and not seek the appropriate care.
Doring says the number of heart attack and stroke cases they treat have gone down during the COVID-19 pandemic. They're barely seeing any patients with these health emergencies.
They don't come in at all, and like I say, may end up dying as a result.
He says EMS crews told him they're responding to a lot more calls where patients are dead upon arrival. It's why he wants people to go to the ER if it's an emergency.
Plenty of capacity right now to be seen in the emergency department. It's not going to be overcrowded or lengthy waits.
Riverview Health ER nurse and program director Lynn Bunch knows many people may be fearful of catching coronavirus, but all hospitals are set up to keep people with the virus separate from others.
We have separate paths through our emergency department and urgent care for COVID patients and non-COVID patients,
while at the same time keeping the staff safe.
They're able to do a lot of their more frequent functions outside the patient's room.
ER physicians want to reassure Hoosiers it's still safe to come. And don't hesitate if you're having a medical emergency. It could mean life or death. Reporting for CBS 4 News, I'm Aaron Cantrell.
Riverview Health has set up virtual ER visits so people can avoid going to the hospital. It's a non-life-threatening emergency. If you can go online and set up an appointment to meet with a physician. To find out more about the service, visit cbs4indy.com.